Hi, so right now I'm here to perform doing oxygen scenarios. So I've got called in an ER, especially there's someone patient that needs to be hooked up with an oxygen device. So first is I'm going to introduce myself. So hi Mr. Smith, my name is Anthony and I'm a respiratory care student from the respiratory department. So I've noticed the patient to be lethargic, of course, and then maybe the patient also I've noticed to be having retractions, nasal flaring, with their SpO2 to be about 88 to 89%, and then patient is lethargic. So first is I will sanitize my hands, or wash my hands, and then after that I will always make sure to check the patient's chart, especially if what specifically device or flow that the doctor would like the patient to be put up. So because the doctor wanted to be to hook the patient with a nasal cannula with a flow of 3 liters. So I have here the nasal cannula. Make sure I'm gonna set the flow at 3 liters, and then before putting up to the patient, I'm gonna feel the flow. There's air coming out from the device. And even though the patient is lethargic or not too responsive, still we will explain it to the patient. So Mr. Smith, I'm here putting up a nasal cannula. So I'll just put this one gently to your nose, and then I'll just have to lift your head a little bit so that I can put this one up in your head carefully. That. So I'll just have to loosen up a bit the connections, and then I'm gonna assess the patient afterwards. So like this, the patient already put us on the nasal cannula. I'm gonna reassess the patient, and then after that I'm going to leave, and then in a few minutes I will reassess the patient. So right now I'm here reassessing the patient with the patient on the nasal cannula of 3 liters, and then when I observe still the patient is distressed and with the SpO2 still with that range of 88% to 90%, and is also lethargic. And then when I assess the patient, still they're unconscious, and then when I notice their breath sounds is still kind of congested. So I recommended it to the patient, to the doctor, to hook it up with a simple mask because of what the present situation the physician of the patient is. So I'm gonna turn off the device. And then with a simple mask, I recommended to be with a flow of 6 liters per minute. So in that way, the patient would receive high oxygen. So I'm going to put this one, make sure it's loosen it a bit before putting up to the patient, and then make sure that there's air coming out, and then carefully put in the patient's head, and then after that we can observe the patient and then reassess, and then in a few minutes, well, I'm back right now. After in a few minutes I hook up with a simple mask. I've noticed the SpO2 of the patient rises up, so it's more about 92 to 93 compared to the previous one, and then the patient is kind of conscious in a little bit, and then when I observe the auscultation, there's the congested was almost totally gone. So after that, doing everything the patient assessment, I will always ensure to wash my hands and then document everything, and then explain to the nurse station or the physician if the patient was doing well, especially with a simple mask that was being put up compared to the nasal cannula. And also the nasal cannula should be put up in a safety or clean container, just in case if we're gonna shift it from simple mask back to nasal cannula. And I think that's all.